one thing that's been in the news very much in the last week or so and has really been very political is the Affordable Care Act, also known as Obamacare. As open enrollment for 2017 approaches, the cost of health care premiums have risen by an average of 25%. And in an effort to prevent sticker shock, the Obama administration says the subsidies that offset the cost will also increase. However, critics point out that taxpayers will foot the bill. I think it was interesting because this has become a political rallying cry for Donald Trump, and I think that he can take credit for some of the uptick in support, and also Republicans saying, hey, this is something that we can hang on to and we can use in the political arena. But I want to take a look at it in terms of, you know, Shirley, in terms of policy and why this is happening now, in terms of what can we do to change this, because both candidates say it has to change. So whoever is going to be in the White House, they're going to be in charge of trying to change it. So Nolan, when we say that the rates go up, and you see in some states it's astronomical, in some states it's actually gone down, does that mean that the Affordable Care Act, that Obamacare is failing?
Well, it's not affordable. I mean, the rates are going up nationwide 25% next year, and it's hard to mitigate that when you don't have the ability to write unlimited subsidies. And, you know, I think where it's going to play out, of course, is in the congressional races. I think people are going to go very angry, and if these Congress people are talking about Obamacare and fixing Obamacare, I think that's going to resonate with voters. But we've got to move it out of the political realm. Right now, and since its passage, the Democrats have been, you know, extraordinarily defensive of it. They see no flaws in it, because to admit there's flaws, is to admit they got it wrong.
The president has gone and said it's flawed.
He's proposed no fixes. And, you know, Republicans have been all about let's scrap it. They've got to find some middle place where they can figure out what's driving up these costs. From the beginning, Obamacare should have focused on cost rather than access. You control cost, you increase access, and instead they've allowed these costs to just get out of control.
So what's the middle place?
Well, so first of all, let's talk about what's actually going on. This is the market side of healthcare reform that's out of control, right? It's not the government side. The government side, where we are signing more people up for insurance, the 20 million people who have insurance now who didn't before, that part of it is working the way it was supposed to. The markets that we created, these exchanges, attracted high-risk people into the pools and not the low-risk people, and they attracted a fraction of the number that the government predicted. They had predicted 22 million people would be on the exchanges by now. Now it's 10. This is the way markets work. And early markets,
there's nothing market about this.
It's absolutely a market. I mean, this is the exchange. This is the Republican end of the idea that is not working. And so what you've got to do, first of all, you got to be patient with new markets. There are lots of fluctuations early in markets like this. You also have to get more people into those. The only way those exchanges work is if they have a mix.
If you have a mix of people of healthy and not so much. So then, what is that? Is that a higher penalty for those who don't come on board?
There are a number of different ways you can talk about trying to do that. You can also try to adjust other parts of the law to try to maybe suck up some of the people who are not on the exchanges. There are a lot of different ways you can think about trying to address that. The problem has been that the Republican answer has been just no. I mean, they voted 45 times to repeal, as opposed to engaging with the president, who has gone over to Congress several times to talk with leadership.
Sent them a single fix.
Gone over there, well, because he goes over there to talk to them, they say, we don't want to talk about it.
So you're saying that politically it has been more of a yes or no proposition as opposed to an
you try to assign any of this to Republicans. Republicans had no input on this. This was an entirely Democratic proposal.
They didn't
and there's also nothing market about this. The government has distorted the marketplace here. You have a situation where you have the president saying, be patient, it's going to be better, and people are getting hit with 25% price increases. You've got families now, you say more people are insured, it's working the way it should. You've got perhaps more people totally insured, but you have a lot more people who can no longer use their insurance or use their medical care because they have to make a decision. Am I going to go have this test? Am I going to have this procedure and have to pay $4,000 or $5,000? Some plans have $14,000, $15,000 deductibles and copays. Their insurance is useless to more people than ever before.
I think what's happening at this table. Hang on, Nolan. I think what's happening at this table right now is illustrative of everything that has been going on in Washington right now. As we're bringing in the political side of it, where there seems to be you can only win if you're Republicans saying we got to get rid of the whole thing and
The
start
Republican answer
over
was,
again.
let's not do it in the first place, and then the answer has been, let's repeal it. They haven't put anything on the table.
Do you start with what's there,
You've got
Norman,
Hillary Clinton
and add
on the
to it, or do you
campaign
repeal
trail
it
saying,
totally?
you know, we'll make a few tweaks, this thing's going to work. This is not going to work. It needs a major overhaul. And before you can get there, you have to have the president. You have to have the president. You have to have the Democrats in Congress saying, we agree it needs a major overhaul, and they won't get there.
Is it an overhaul or a start from scratch? Hang on. Is it an overhaul or is it a start from scratch?
You can't start from scratch. You've already ruined the market. So you can't ask these insurance companies to go back and forget everything they've done and this billions of that they've spent. You need to address the cost aspect of this. So the first thing you need to do is try to figure out what is driving up these medical costs and attack the costs very, very aggressively.
Okay. So
then you can start bringing down the cost of insurance.
Number one, the idea that the president, so this is like a fundamental misunderstanding of the way the government works. The president does not propose bills. The president does not propose legislation. The Congress does. Who's in charge of the Congress? Who's been in charge of the Congress since 2010? Republicans. They have
the minority plays a role, Steve. They have not.
Hold on. The Republicans have not proposed a single change to Obamacare other than to try to repeal it.
Absolutely has.
That's not true.
Paul Ryan's got a complete plan out there.
What bills have they passed in both chambers and sent to the president?
What bill would the president sign?
Well,
what bill would the president sign? What bill could you get through the Senate?
Let's talk about it, and all they want to talk about is repeal.
The time to have gone over there and talked to it would have been before it passed.
But he did.
But he did.
He spent a year talking with Republicans and Democrats.
Not a single Republican amendment was adopted.
Because their goal was to make it not
This is what is going to be on the agenda in January.
Well,
I think so.
I mean, the truth here is you've got you're going to get to a point where the middle class has absolutely no health care protection and are spending the bulk of their income, their disposable income, on health insurance.
We are going